Hello, everyone, and welcome back to MediInsights. Today, we explain azathioprine injection, what it treats, how it works, dosing, side effects, and safe use. If you or someone you care for may need immunosuppression, this quick, clear guide will help you understand key facts to discuss with your clinician. Starting with use of azathioprine injection. Azathioprine injection is an immunosuppressant used to prevent organ rejection after transplantation and to treat some autoimmune conditions such as rheumatoid arthritis and inflammatory bowel disease, especially when oral therapy is not appropriate or when rapid control is needed. Your doctor will decide if the injectable form is right for you based on your condition and treatment plan. Next, dosage of azathioprine injection. Dosing depends on your weight, the reason for treatment, and your response, and it is individualized by your physician. For transplant use, many guidelines describe an initial range around 1 to 5 mg per kilogram once daily, with maintenance dosing often between 1 and 3 mg per kilogram daily, while dosing for autoimmune diseases is typically lower and titrated carefully. Your doctor will start at a safe dose, adjust slowly, and order blood tests to guide changes. Next, mechanism of action of azathioprine injection. Azathioprine is converted in the body to 6-mercaptopurine and then to active thioguanine nucleotides that interfere with purine synthesis and DNA replication, which reduces proliferation of B and T lymphocytes and lowers immune activity. This effect helps prevent graft rejection and calms immune-driven inflammation, but it also lowers your natural infection defenses. Next, side effects of azathioprine injection. The most important risks include bone marrow suppression causing low white cells, platelets, or red cells, increased susceptibility to infections, liver toxicity, nausea, and rarely pancreatitis or severe allergic reactions. Long-term use is also linked to an increased risk of certain malignancies, including lymphomas and skin cancers, so routine monitoring is essential. If you develop fever, sore throat, unusual bruising, jaundice, or persistent nausea, contact your healthcare team promptly. Next, important advices for using azathioprine injection. Before starting, your clinician will usually check your blood counts, liver tests, and enzyme activity for TPMT because low TPMT increases risk of severe toxicity, and your dose may need to be reduced or an alternative used. Avoid live vaccines while on therapy. Use reliable contraception if pregnancy is possible, protect your skin from sunlight, and inform your doctor about drugs like allopurinol, which require a major dose reduction of azathioprine. Always attend scheduled blood tests and never stop or change doses without medical advice. Thank you for watching. If this helped, please subscribe to MediInsights and leave a question or comment below so we can cover it. Stay informed, stay safe, and always follow your healthcare team's advice when using azathioprine or other immunosuppressants.